All right, so moving right into the work session. Like I said, I think it's a pretty easy day. I did put out here you'll find in your notes there, City of Lubbock Health Department STD Clinic. This is a part of my request or suggestion to the board that we kind of fan out and start looking at different areas of the health department so that we can educate ourselves as well as educate the public about what exactly goes on. And the reason that I picked and have gone out and visited with our staff at the STD clinic is, of course, we were looking at some questions about funding changes, and so I thought it would be helpful for us to better understand what goes on in that clinic so that we can speak to the issue when we're talking to other people in the community, and if we have perchance an opportunity to talk to the city council. Scott, what's the status on, have you heard anything else on funding from the state?
No, just a letter that we received that said that they would be cutting that grant back to $100,000, and it will be in the proposed budget for full funding as we are now staffed and now serviced, that the city will pick up the difference between the funding levels from last year and this year with any increases that are normal for benefits or things that come in as routine increases.
Which, if I remember right, the funding amount that you had showed me, or I forget exactly, $109,000 was the funding last grant cycle, right?
Correct.
So we're going to lose about $10,000,
no,
it sounds like?
No, 90.
Oh, they're
190 to 100.
190 to 100. Oh, okay.
Yeah, so about it would be 90,000 that would be going into the general fund budget this time. That was being provided by the state will now be funded locally if the council approves that level of funding.
Okay. Do you anticipate much of a conversation about that, or?
I could not tell you.
Okay. So, Councilwoman Joy, do you have any thoughts?
Just simply that when we start talking about the budget, it kind of gets thrown at us from all departments. So you really kind of need to be aware when we're getting ready to talk about the budget. I think the board at least needs to have somebody there to kind of say, you know, this is what's happening. I don't know, Scott may be able to do that.
I think that will be presented in the summary that y'all will receive. Will be deficits and grants and other things and increases that are being asked for. Needs, we'll have a needs list that we believe are priorities, and it will all appear in one of those categories to be presented to the city council to say, this is a balanced budget, and here are the things that are in here with these funding needs that have been identified either through lack of state support, federal grants, local grants, arts groups, whatever. And these things are included, and here is an additional list of needs that we are recommending funding for, but it will not be a part of that balanced budget, but our $90,000 will.
And so that
kind of two different lists.
It'll be part of the balanced budget. That doesn't mean the budget will be approved, but it's
Right.
part of what
Right.
they're going
That'll
to
be
be
up to
presenting. That's
council.
what I said.
Right.
and that's like late July through August,
And
kind
there'll
of.
be two of those public hearings, I believe, is what Mr. Joy is talking about, that you'd probably want to be present for or have the opportunity to participate in at that particular point, either to support your recommendation for the health educator, which would be an addition to that budget also,
Right.
but it's been requested, and I think it will appear in that balanced budget also.
Mm-hmm. Okay, all right. Just continuing forward on that regard, in the handout here, and I would like to take note of the fact we have two of the staff from the STD clinic here today. Would you guys stand up and introduce yourselves?
I'm Councilwoman Cena, and I manage the laboratory in the STD area. And I'm Marissa Jones, and I'm one of the LVNs.
Okay, we appreciate your being here and serving that capacity. How many years y'all been with the health department?
I've been with the city 23 years, and I've been 3 years.
Okay, so we got some real commitment to improve things. You'll notice in the handout I pulled together some information from my visit. I went out on a Friday morning and visited with the entire staff, and I pulled together some things for you to look at. I think it's significant to note, and I've summarized it kind of in those first two pages, but in the latter pages you'll see demographics in terms of shifts of time, patient demographics, and then a little bit about the types of STDs that they're seeing, etc. But to just take a note, again, I wanted to boil it down, so on the very first page, I talk about in that third paragraph down, you can see Lubbock, our problem with STD infections. New visits to the clinic, you can see we're at about 1,300 in 2009, and we're at 1,600 in 2012. And then total visits to the clinic, you can see how those have increased by almost 1,100 over that same period of time. Our rates continue to go up for syphilis, gonorrhea, and chlamydia. You can see that the breakdown of males and females continue to both increase. We have comments about chlamydia being the most common STD in the area. Then toward the bottom, I've got a list there of who staffs it, what they do, the physician involvement, educational components, and then moving over, talk about their coordination with other community resources. And you heard Scott just say that the current funding, which is $190,000, is going to be cut by almost half. And then it gives a listing there of what the funding pays for under the current program. And I give a list in there talking about some studies that I found that cited this is particularly devastating for the youth, 15 to 24, and so that's the target audience if you want to look at who we're trying to reach to. And then talking a little bit about some of the ways that education is handled in the public schools. And just saying the point that I think that we can all look at this and agree that as this issue comes up for budgetary consideration from the council, that we really want to step up and not let this be altered. I mean, I know these are tight budgetary times, but public health has always been at the forefront of STD eradication, and I think that that's where people go. It's interesting as you visit with people that they don't like going to the regular doctor for STDs, that they want to go see somebody anonymously. And so I think that that's particularly true, that's why we need to keep the city health department involved in that. So if you keep on through there, you can see under patient demographics, there was a list there, and that's all at the top, September 09 to August 10. But then at the bottom, my handwritten notes, I continue those numbers out to show you the demographic change. And so you can see that it continues to expand across all areas. And then the next page, I have the sexually transmitted disease clinic, the grant period, and it shows how many draws, how many were active, how many treated for a time span of about 3 years, and I'll look at that. And then the last two pages are the actual intake forms that are used by the clinic, in case you're wondering sort of what information we track. And then the second page is the registration. And even though they ask for a $20 fee, that this is something that they can make accommodations for if it becomes a problem. Is there anything I've left out, kind of day-to-day operations of the STD clinic?
I think you covered it pretty well.
Okay. Any comments or questions about this? This is an informational item, not really a discussion, no
The
action.
increase is disturbing to me. That's pretty significant increase over a 3-year period. And the population has not grown that much. What's behind the increase?
Any thoughts?
To a certain extent, we have increased the amount of people that we can see at the health department. Of course, these are just stats for the health department, not for the whole city or for the whole county. I think the health department has done a much better job of, we've done a much better job of letting people know that we're here.
Approach the podium. Thank you.
You can see me and hear me. We've done a much better job of letting people know that we're there. We have increased our hours and the number of people that we can see. So it may not be a total increase of the number of diseases, but an increase in the amount that we're seeing at the health department.
Okay. Dr. May?
Do you see people only within Lubbock or Lubbock County, or do you see people in an expanded area? How does that work, and how the university? We have 3 major colleges here. How does that population fit in, since many of those people are from out of town, they're not Lubbock residents?
If they walk through our doors, we see them. Marissa may know more about the number that we see from the students.
We see a mixture of everybody. Anybody that walks in the door, they can be. We've seen people that are visiting from California. I mean, if they walk in our doors, we see them no matter where they're from. So, and when school's out, we see a lot of college students more because.
When schools Out or in session?
out when they're, like for the summer and spring break, because it costs more to use the clinic on campus. And so they can come to us for $20 and a lot of them, you know, at Tech, I know they started billing insurance, and so they can come to us and their parents won't find out. And so it's a lot easier for them to come see us for $20. Nobody knows, they don't have to bill their insurance, they don't have to do anything, all anonymous.
So it's a cash transaction?
Yes.
Now, at Tech, in the past, when I was at Tech, the students would heavily use the clinic there. Now, that you're saying that's those demographics, that's changed, so more students are coming here and using the Texas Tech clinics.
We still get, I mean, I think they're still using it on campus, but when I worked for the clinic there, I think in 2010 or 11, they started billing insurance. And so they're under their parents' insurance, so they get an explanation of benefits mailed to their house, and their parents find out.
With the diagnosis on it?
Or medication charge or something like that, and so they don't want that. They don't want their parents to know that what's going on here, so they can come to our clinic and pay their $20 is confidential. Their parents can't call and find out why they're there or anything, so I think it's...
Marissa, we don't see anyone under the age of 18 without parental consent, or what's the rule
Under
there?
13.
Under 13?
A 13-year-old can walk into our clinic and be seen,
Okay.
and it's all anonymous. Their parents can't get any information.
Is that by state or by federal law?
I think it's federal law.
Really?
I believe it's just at the health department and not at a doctor's clinic.
They can go to a doctor's clinic and be seen and
The doctor's at that age too, okay.
If it's sexually transmissible, then it's
transmitted.
not proven, not...
Yes, they can go to a doctor's clinic and have a pregnancy test done, and it's confidential. They can have STD checked.
13.
Okay, Dr. Reed?
So you're seeing, let me clarify first. So the state money's being dropped down to 100,000?
Yes, sir.
So we're losing 90,000?
Yes, sir, and it's my understanding, and Becky was here because my memory's in and out these days, but it's my understanding that we're still the only STD clinic in the state that is receiving grant funds.
Yes.
Is that correct?
Yes, from DSHS we are.
So I anticipate that it will continue to drop or go away completely.
So how's that going to affect the performance of the clinic? Do you have any idea?
Well, our proposal, of course, will be that we need the clinic, and it, of course, serves a needed population, and so we would recommend that it be funded from locals' money.
City money?
Yes, sir.
City.
I mean, there's nowhere else to get it. The state, you know, the
Do you get
state
any
is...
federal money at all, or is it the
No,
state at
we-
the upper level?
We don't. We don't get any federal money.
Is there any participation from the county?
No, ma'am. Not at the health department. There is at the libraries and vector control, but not at the health department.
Who handles county outside of City of Lubbock? What happens to the county people out in the Lubbock County or other counties? They can come in, right? And they can get service, but we don't have any contract to supplement that from other counties.
Dr.
I'm sorry, Anna.
I looked at this information about 3 years ago, and there's the Lubbock County Hospital District has satellite clinics at various places in the county, including several within Lubbock City, as well as some in the county. And those counties do accept patients, but they charge for them. They're charging according to the Lubbock Hospital District. I don't think, and they send their laboratories to, I believe, UMC. But nobody has this system of that you have, that we have here at the STD clinic, of full service to a very wide spectrum of people, regardless of ability to pay. Lubbock County Hospital District has a sliding scale, but it's not quite like this.
And we do same-day appointments, so you wake up in the morning, you have symptoms, you can come in that day. As like community health center, they schedule appointments out. You know, it may be 3 weeks, it may be a month and a half before you can get in and see them. And so that's another bonus for our clinic, is because we accommodate a large number of people in a shorter period of time.
So even if they call in with an STD, they can get put 3 weeks out.
At the community clinic, so they can get an appointment usually in 24 hours.
So they're either getting infection trouble or they're spreading the disease or both.
Okay. Other questions? All right, this is just an informational item and please, if you have more questions, I know it was very easy to get together with you guys when I came down. Oh, Dr. May?
I'd like to make one comment on the second page. This isn't a criticism, but it is back to shaming and fear-based instruction. When we're looking at prevention, all instruction is fear-based. Immunizations. If you don't get immunizations, you're going to get polio, measles, whooping cough, whatever, and die. Guns. We tell people not to play with guns. You get hurt. Matches. Kids shouldn't play with matches. Start the house on fire. Seatbelts. In school, showing all these kids, people get what happens if you don't wear a seatbelt. You fly out of your pickup truck, it rolls over the top of you. So by nature, most of our instruction to people is fear-based. If you do this, you will get in trouble, so do not do that. Or
Okay.
take precautions. Put your seatbelt on.
Okay, so noted. Those are the direct quotes pulled out of that
No,
report.
and again,
so-
this isn't criticism. This is
Okay.
just something to think about, because this is how that's how we approach a lot of things. Is people come into your clinic, I'm sure you say, whatever you're doing, you caught this disease, maybe you should not do
I don't
that,
think
right?
that's not their role.
Oh.
I'm pretty sure they don't do that.
So if somebody comes in and says, gee, I've got chlamydia or got gonorrhea, and I don't know how I got it, and you don't question, he said, well, I've been going to the same prostitute for 3 years. Every time I go, I get... No?
I don't think we even need to address that, do you?
I mean, don't we need a healthcare facility to help people so they don't get
I
the
think
same...
that's a moral or ethical issue that
Well, it's a medical issue.
Well,
I mean, if somebody comes in with
that
diabetes...
we're not in charge of treating their ethics or their morals. And so I believe we stick strictly to
Scott?
the clinical side of this.
Scott, prevention of disease has nothing... Wait,
I
stop.
won't argue with you on this subject. I'm just telling you how I believe we treat the patients.
Right.
Am I right?
We do education and
And
how to
education,
prevent
yeah.
it.
Yeah.
but
Because somebody
that's
comes...
what basically
That's
we're strict.
different
No
from what
judgment.
you're saying.
We don't
No, it isn't.
judge anything. We just educate them on how to prevent it.
I said, how do you prevent? That's all I was saying.
And I think that speaks to the issue of a health educator. If we bring somebody in there who, that's really their area of expertise, that I would hope that they could consult across the entire health department and give us some sense of what are the best practice approaches and what seems to be what reaches out and really makes a difference.
And we do educate, do not threaten or judge, on how it's contracted and how you may prevent it.
It's like we're doing education. I think that's responsible.
Responsibility.
Quick question to Dr.
Yeah.
Epstein. I know you did a lot of work 3 years ago. I'm just curious, these numbers, when I look at it, they are disturbing, but I'm sure there are national benchmarks. How do our numbers compare with the national benchmark per
Terrible.
capita?
Terrible.
That bad?
No, yes, we're terrible. I think it used to be said that Lubbock County had the #1 rate of chlamydia infection in the country. I think that wasn't actually true. Texas was 3rd, and I think Lubbock was 4th or 5th in the state of Texas. So we're really bad.
Or are we really good because we're picking it up? Like you said, people are coming in here and it's getting picked up, it's getting screened.
Other
always,
states,
getting
yeah.
sorted out.
There's always been a question in you'll see the same thing in crime statistics.
Yes.
That if they're reported accurately, and there are some places that I will tell you that I think do not report accurately for a purpose of,
Yes.
it would be a deterrent to visitation or tourism or those other kind of things. So that has been one of the things that has always been brought up when this discussion comes up, in that we report our numbers accurately. We'd leave it to everyone else to decide whether everyone else is doing that also.
There's no question that Texas and Lubbock, highly ranked in Texas, is experiencing a prolonged and large medical epidemic, and that our STD clinic is doing a wonderful job. When I toured the clinic a number of years ago, very impressive professionalism, thorough evaluation of patients, excellent scientific establishment of disease treatment programs. I was extremely impressed. And I'm very pleased that we have the clinic doing the excellent work it's doing. And I certainly think that the clinic's work is critical to stemming the disease tide in Lubbock. And I strongly urge the Board of Health and City Council to support the STD clinic in every way possible.
Dr. Reed?
Mr. Chairman, with all this being said, don't you think it's important that the Board of Health make a recommendation to the City Council to maintain the level of funding that we have had and maintain this clinic the way it is, at least, because this seems to be a very serious problem?
Councilwoman, do you think that would be helpful to have something forwarded so in our July meeting we could take an action item that could be presented at some time after that point?
On the agenda.
Yeah, so we'll just get it on the agenda, Tracy. Okay. All right, Dr. Mack?
I'd like to also make a suggestion that we recommend that the city look into establishing a large volunteer education force for our Department of Health. We have hundreds of retired physicians, nurses, other healthcare people who are looking for something to do, and they would be ideal individuals to go out into the schools, community, and so forth to provide education not only on sexually transmitted diseases, but other communicable diseases, hygiene, and so forth.
That could be a role of the new health educator to organize an effort.
Yeah, I think that'd be great.
Like that.
Yeah, yes.
Use a volunteer force. Give people in this community more things to do to make this a better community. We've got lots of colleagues who are out there retired physicians and out there playing golf and all kinds of. Sometimes they have to play 2 18 holes a day.
Mm-hmm.
Well, I think that's important. The volunteer, we have this advantage of volunteer force, but I think the key thing is this medical educator.
Sure.
Mr.
Thomas?
Oh,
I'm sorry.
Carry it out.
Okay.
What's the status of getting a potential health educator?
It goes with the budget?
Yes.
Okay.
It's requested in the current budget.
So that resolution could tie into both the STD as well as emphasizing that a part of what, even though it's separate funding that we're requesting for the health educator, we see that educator providing an important role in many other areas of the health department. Okay, any other comments? Okay, seeing none, we will put that on the agenda as an action item for the next one. Thank you.
Go run our clinic.
Okay, thank you. All right, moving on to 3.2, update on council-appointed hydraulic fracturing committee. Dr. Epstein.
Well, City Council has appointed 9 people to the hydraulic fracturing committee, and our first meeting is on June 4th. I'm sorry, our first meeting will be June 24th, so we have not yet had a meeting. I must admit, we're under a 90-day deadline, and we haven't yet had a first committee meeting. Judging by the progress of other stakeholders' meetings about fracking that are going on throughout the country, it's hard for me to believe that we can get something of good quality to council within 90 days. So I hope council will be willing to consider extending our time frame as we move forward. But of course, we haven't met yet. There's really nothing to report except the composition of the committee and of the committee. And the first meeting, the agenda of the first meeting is just to review the current status of the ordinances and handbooks. So we're not going to get much done in terms of meeting on the first meeting.
Would you like to address the issue of, at the last board meeting we passed the resolution, and why what is it we're thinking about doing with the resolution, or why it hasn't been presented yet to council?
Well, as Dr. Carr and I were discussing, we have two things in front of us. One is the resolution that we as a board passed at the last meeting, proposing an ordinance to City Council, or what should be included in ordinance. And the other thing is this committee meeting, which is pending to discuss the very thing that we were discussing. And as I talked to Dr. Carr, I'm not sure what will best serve council's needs. Perhaps it would be best served by delaying presentation of our ordinance until we hear more from the Oil and Gas Committee, of which I'm a member, and Dr. Presley is also a member. However, I would be interested in everybody's opinion on that.
Councilwoman Joy, since you happen to be the representative.
Well, I think you need to keep it on a dual track. All in that committee is one group that's working. Your recommendation is, to me, totally apart from that. Now, they're going to be talking, I think, in those meetings about your recommendation, but I would keep them on a dual track.
But would you believe it helpful to have us present it to council as a separate
I do,
item?
but I think you need to give this committee some time
Okay,
to work.
okay.
I think if you present it now, it will lose some of its emphasis.
Okay.
All right.
All right, other thoughts, comments? All right, seeing none, we'll move on. Communicable disease report, Mary.
Okay, all the enteric diseases were at or below the expected number for the past 30 days. We only had 2 vaccine-preventable diseases, one chicken pox and one pertussis. We had 1 malaria case, but it was imported from the People's Republic of Congo. It was an adopted child that came to the United States with malaria. And 4 invasive streps, 3 strep pneumo, and 1 group A, and the group A did die. It was a 93-year-old person. And we investigated and provided education to all the cases.
Okay. Any questions, comments? Dr. Mack?
Curious what type of malaria organism was in the child?
Oh,
In the child, was it?
I know, but
Did the child do okay?
she's fine. She's fine.
So well treated then.
Yes, and I cannot remember.
That's
Okay, thanks.
Most commonly, it's falciparum.
Is it?
Hers wasn't.
Oh, really?
In fact, we have a case now that is the falciparum that was also imported.
Do you have a
But-
case now, you said?
No, it's
Yeah.
the most common.
Yeah, that's the most
But
common.
yes, we do have a case now that'll
It's
be
not
imported next
falciparum,
month.
right?
The one now?
The one we had is not falciparum.
No,
The child.
the child.
Good.
Was that, wasn't central nervous system involved? Or-
No, she did very well.
Good.
She did very.
Okay.
I don't know the last time we had a case of malaria here, I can't remember.
And we have another one right now.
We have one
Mm-hmm.
in the hospital or?
No, not anymore.
It's,
Fully recovered.
it's typically imported either by adoption or somebody traveling and not
Somebody's
taking
traveling today.
This was
mosquito prophylaxis.
Travel without prophylaxis on the one now. For
Okay.
30 years traveling, with no prophylaxis.
What's the
Yeah.
best prophylaxis these days other than DEET?
Well-
That's
Mosquito spray, DEET.
I certainly give all my patients who are traveling to malaria-prone areas, there's a big interactive map on the CDC.
Yes.
Everybody can go to that website, it's free, and many people do, that gives you regions of malaria involvement and gives you type of malaria and the recommended prophylaxis from the CDC along with alternatives. And I always attempt to give my patients full malaria prophylaxis when they're traveling.
Chloroquine, or do you use antibiotic?
No, it's not typically chloroquine. It's Malarone, typically doxycycline.
Doxycycline.
Especially, Malarone is very expensive. And so for people who go and spend a long time, Malarone becomes prohibitive, and many of those people prefer doxycycline.
And that's effective on all malaria organisms, the doxycycline?
Currently.
I think so.
And that's
Chloroquine resistance is fairly common.
Weekly dosage on the doxy or
Doxy's daily.
It is daily.
I think
Malarone is-
Malarone is weekly.
How does Malarone function?
I believe it's a chloroquine analog.
It's like a chloroquine analog.
Plus
Okay.
a second agent, it's a double agent.
Does it have any of the eye involvement that chloroquine does?
I don't think so, but there can be CNS side effects.
Yeah. The side effects can be quite profound.
Yeah.
Yeah.
All right.
I think something just came out.
You completely lost me in this discussion. I'm glad to know that we've got people on top of this.
You handled it well, Brian.
Yes. Yeah, I
All
have-
right.
I have an app.
Anything else for Mary? Any other questions? All right. We've got Bridget here to join us for Victor Control report. And I guess, didn't Dallas have some reports of West Nile and such last week? But we're good.
Yes, we are good. We have submitted, in fact, 98 samples to TIE, and not one of them has been positive. So that's a good thing for Lubbock.
Excellent.
But really, We've had sporadic rainfall until just recently, and so we would not expect to have big, large populations of mosquitoes until next week. And it's going to explode. We're ready for that, and we have made plans, and we're going to be spraying, blanket spraying probably, because complaints are expected to rise dramatically.
And what the public can do is that if they have any container that has any kind of standing water in it, big or small, dump it out. Make sure that you don't give them an opportunity to breed.
Absolutely. And we're going to send out a press release Monday, because Monday starts Mosquito Awareness Week.
Good.
And so we're going to focus on prevention and try to push that message out right as the mosquitoes are hatching.
That includes fountains.
Right. Any place water is. Tires, old tires sitting out.
Baby pools.
That's a big one, Brian, because a
Tires.
lot of the schools have tires that they use
Yeah.
for their football team, and they're stacked and they get rain in them. Rush Elementary is a big problem. Is there a way that we could get information out to the schools to have them dump water
We
on their
can
tires?
sure try to.
Next week,
I
we'll
know
do a public press release.
It would be
Get
good
it
to
coordinated.
direct the schools, hit the schools, because the schools never seem to get the information.
We'll
They
send it
usually,
over to them.
I believe
That
that
would
they
be
were
great.
required to start
The
drilling holes in
administration.
the bottoms of those tires.
Are they?
Yeah.
You know, they may become stopped up, you know, over time, but it is good to remind them
Just to
periodically,
dump the water on
absolutely.
it.
And I saw Sam's had Deep Woods off, which is, I think, a pretty healthy dose of that deep stuff, isn't it?
Yes.
You can buy six cans on sale. Buy them while they're hot. Okay.
Citronella doesn't work.
Yep, citronella doesn't work.
Other
Okay.
thing you can do is spray under your eaves inside of your house with 10% permethrin. I use the dairy barn spray, same stuff we use at the farm. You get 10% permethrin, spray the walls, and it doesn't get washed off. Because every time a mosquito bites you, it comes in, lands on a flat vertical surface, rests, bites you, goes back, rests, and then takes off. So you got two chances of getting hit. And that's why DDT was so effective, because if you sprayed the walls of the house and outside buildings, you have a huge chance of that mosquito coming in and landing. So probably the safest thing we have here is permethrin, which
Okay.
is
It's a plant-based. It's
plant-based carnation,
not
synthetic from normal
not toxic to you.
Okay. All right.
normal chemical that comes in carnation. And my advice would be, if you buy permethrin, look on the label to make sure what the brand you're buying is certified for dairy barns,
Okay.
because that will give an increased enhancement of safety.
All right. Anything else for Bridget?
So it's
Yes.
okay to put in your milk too?
What's that?
It's okay to just put directly in your
Well,
milk?
I don't know
also?
about that, Scott. I mean,
Okay.
But we use it in cattle and in hog barns and so forth. Sometimes they'll mist it in there.
Just a little bit.
Sometimes they'll spray
All
the
right.
walls. I don't think you want to put it, it's not like putting a little bit of brandy in
Got
the
it.
kids' milk at night. No.
Got it.
All right, seeing no other report from Bridget then, the last item, 4.1, approval of our May minutes. Do I have a motion to approve? Dr. Reed, do I have a second?
I second that.
Ollie? Okay, seeing that, all those in favor say aye.
Aye.
All those opposed? Okay, they're approved. All right. The only other thing I would note is I passed on, Becky's not here, but the NACCHO, which is the National Organization for Community Health Organizations, such as our health department, they're having their big meeting in July. And if you're not a member, they have a monthly newsletter that comes out, and it's really pretty good. The web address of their website is NACCHO annual. Well, I guess it's probably NACCHO.org. And you can sign up, and then they email you their, and they have good little articles.
Where's the annual meeting?
Dallas in July. So if anybody's heading out this way, we can give you information about it. But it's good for us to stay involved. Okay?
What is it again, Brian? NAC?
NACCHO.org.
And what is it, national?
Well, it's NACC. It's a community health organization. I'm not quite sure what the C is.
It's
Okay.
the National Association of City and County
County.
Health Officials.
There we go.
Okay, got it.
Okay. Thank you, Bridget.
That's why Bridget's.
All right. Any other business before the board?
Brian,
Yes,
I
ma'am.
wanted to follow up with you about the health initiative in the city, and you talked about it before. Would encourage you to continue to work on that as a project. we need to get people up and moving and exercising and eating right and all of those things. And I know you all started on that, kind of had to pull off, maybe for some funding reasons, but I want to encourage you to continue to do that because I think that's extremely important to this community.
Yeah, that goes back to remember the a pound a person program, and then we, Councilwoman Joy and I have talked about a possibility of an organization that could be a 501c3. That was the missing link that we didn't have, so I appreciate that reminder, and that's something we'll be gearing back up and seeing if we can make happen. All right. Any other announcements? Anything note? All right. With no further business in, we are adjourned. Till next month.
Always.
All right.
Yeah.
Yeah, that was very good.
Yeah.
Very good. Good job.
Well, I just think we got to, and really for across all the different areas, we need to be able to, if somebody says, so what is it about immunizations down there at the health department? We can say this.
Malaria, how to treat resistant malaria prophylaxis.